In the company gym, an older gentleman complains of chest pain and an uncomfortable pressure and squeezing in his chest. A coworker unloading his truck suddenly collapses to the ground. An infant is found unresponsive and not breathing normally. Medical emergencies and accidents like these happen every day to coworkers, family members, or people you meet on the street. These emergencies are an unfortunate but inevitable part of life. Some experiencing a medical emergency simply need a helping hand, while others will die or suffer permanent injury without immediate attention. In an emergency, many variables can separate those who escape serious disability or death from those who suffer long after their misfortune or die. Individual fitness and health, the severity of the initial incident, the distance from medical care, and often just plain luck make the difference. You can't control these variables, nor should you expect to, but you can control one variable when you're on the scene of any medical emergency: you. Often, a layperson providing emergency care tips the balance in favor of life versus death, or complete recovery versus long-term disability. If you're there, you can provide that care. No, you can't guarantee that a patient will live or fully recover. There's too much beyond your control. But given the circumstances, you can see to it that everything that could be done will be done. You can give the patient the best chances possible. In an emergency, what do you do? For that matter, how do you know what to do first? Although these questions may appear overwhelming, actually they're not. This is because no matter what the nature of a medical emergency, you follow the same steps in the same order. In the Emergency First Response CPR and AED course, you will learn to provide emergency aid for someone who is unresponsive and isn't breathing normally. Unresponsive patients who aren't breathing normally do not have a normal heartbeat. You may also learn how to assist a responsive choking patient. In this course, you'll learn to apply emergency care following the same priorities used by medical professionals. All Emergency First Response courses follow the emergency considerations and protocols as developed by the various members of ILCOR, the International Liaison Committee on Resuscitation. Although CPR and AED is an internationally based course, local variations in skill technique, first aid procedures, terminology, requirements, and course flow may exist. Your Emergency First Response instructor will guide you. The Emergency First Response CPR and AED course consists of 3 major topics. Based on regional requirements, your instructor may have you learn any or all of these topics and their related skills. The first is CPR, cardiopulmonary resuscitation. CPR provides oxygen to the brain and core organs, even when a normal heartbeat is absent. The second is AED use. AED stands for Automated External Defibrillator. AEDs attempt to correct an abnormal and inefficient heartbeat. Lastly, you may learn how to help a patient that is choking. This video supports the important background information learned from your Emergency First Response Participant Manual and what your Emergency First Response instructor will cover during the course. You'll watch the video or sections of it and review the related material in your participant manual. You'll do this either on your own or in class. During class, your Emergency First Response instructor will answer questions and demonstrate each skill. After watching his demonstration, then you'll practice each skill. Finally, you'll have the opportunity to apply what you've learned to simulated emergency scenarios created by your instructor. These take your skills to the next level by letting you analyze situations, form a plan, and then adapt based on what happens, just like you would in a real emergency. In the course, you will learn up to 9 essential skills that link together when you help someone experiencing a life-threatening emergency. Skill 1. Scene Assessment. Skill 2. Primary Assessment. Skill 3. Adult CPR Chest Compressions. Skill 4. Adult CPR Chest Compressions combined with rescue breaths. Skill 5. Adult CPR and AED use. Skill 6. Child CPR and AED use. Skill 7. Infant CPR. Skill 8. Adult and child choking. Skill 9. Infant choking. The chain of survival illustrates the 4 links of patient care. It emphasizes the teamwork needed in emergency situations between you and professional emergency care providers. When you recognize a potentially life-threatening emergency, you help with the first 3 links in the chain of survival. The 4th link involves professional emergency care providers only, EMTs, paramedics, nurses, and doctors. Let's look at each of the 4 links in the chain of survival. As an emergency responder, you must first recognize that an emergency exists. Once you've determined that an emergency exists, evaluate the scene to determine if it is safe for you to assist the patient. If it is safe for you to assist the patient, you next determine if the patient is responsive and breathing normally. If he is unresponsive and not breathing normally, you must rapidly activate the EMS in your local area. This link also involves you, the emergency responder. A person who is unresponsive and not breathing normally needs CPR immediately. Early CPR is the best treatment for these patients until a defibrillator and more advanced trained professionals arrive. Effective and immediate chest compressions prolong the window of time during which defibrillation can occur and provides a small amount of blood flow to the heart, brain, and other vital organs. Immediate CPR can double or triple a patient's chance of survival when experiencing abnormal heart rhythms or sudden cardiac arrest. This link also involves you, the emergency responder. Combined with CPR, early defibrillation by you, the emergency responder, or EMS personnel, significantly increases the probability of survival of a patient who suffers a sudden cardiac arrest. During this course, you will learn how to use an automated external defibrillator, or AED. If you witness a cardiac arrest and an AED is available, you should begin chest compressions and use the AED as soon as possible. When applied to a person in cardiac arrest, an AED automatically analyzes the patient's heart rhythm and indicates if an electric shock is needed to help restore a normal heartbeat. By learning how to use an AED in this course, this link in the chain of survival also involves you, the emergency responder. EMS personnel and hospital staff can provide advanced patient care that you cannot. The advanced care EMS personnel and hospital staff can provide includes artificial airways, oxygen, cardiac drugs, and surgical interventions. After initial on-scene care, EMS personnel take the patient to the hospital for more advanced medical procedures. The patient remains hospitalized until no longer needing constant direct medical attention. Have you ever wondered how medical professionals know what to treat first when they help someone? They use a cycle of care to sequence treatment and monitor a patient's medical status. Using the memory word ABCABS, the cycle of care speaks directly to a pathway of priorities for emergency care. By learning the memory word ABCABS, You'll know what to do first, second, third, and so on when a person with a life-threatening illness or injury needs your assistance. You will practice using the memory word ABCABS in a cycle of care as you learn emergency first response skills. The meaning of the memory word ABCABS is as follows. Within the AB portion of the memory word, the first A in ABCABS stands for airway. Essentially, the A reminds you to ask the question, is the patient's airway open? Also within the AB portion of the memory word, the first B in ABCABS stands for breathing. This letter reminds you to ask a question, is the patient breathing normally? In the cycle of care, you begin by initiating a very quick check of the patient, attempting to answer these two questions. Is the patient's airway open, and is he breathing normally? If the patient's airway is open but he's not breathing normally, then call emergency medical services and quickly move into the cycle of care. Within the memory word ABCABS, the CAB portion of the word reminds you how to perform CPR. Let's see how. CAB stands for chest compressions, airway open, and breathing for the patient. When a patient's not breathing normally, you must act immediately to provide chest compressions. After chest compressions, you open the patient's airway and then breathe for the patient. As defined earlier, this is how CPR is administered. After breathing for the patient, you continue to move through the cycle of care by returning back to chest compressions, opening the airway, and breathing for the patient. You continue with the cycle of care until professional help or an automated external defibrillator, AED, arrives. During this course, you'll learn how to use an AED in combination with CPR. If the patient is breathing normally, you move along the cycle of care to the S portion of CABS. The S in CABS reminds you to look for and treat serious bleeding, shock, and spinal injury. You can learn how to handle these three life-threatening emergencies by taking the Emergency First Response Primary Care CPR course. When you witness a serious car accident or watch someone take a bad fall, it's reasonable to assume the patient will have life-threatening injuries. Even if you didn't see it occur, many accident scenes clearly point to medical emergencies. Unfortunately, not all life-threatening emergencies are so obvious. Some serious conditions occur due to illness or subtle accidents. Sometimes the patient's symptoms come on quickly, and other times the patient gets progressively worse over time. Because time is critical, you need to be able to recognize all life-threatening conditions and then provide appropriate emergency medical care. A heart attack occurs when blood flow to part of the patient's heart is stopped or greatly reduced. Heart attack patients commonly complain of stabbing chest pain behind the breastbone and an uncomfortable pressure or squeezing, often described as a tight band around their chest. This usually lasts for more than a few minutes, or goes away and comes back. The pain is sometimes described as an ache or feeling similar to heartburn or indigestion. Pain or other sensations such as tingling, pins and needles, numbness or heaviness can be experienced in the patient's arms, frequently the left arm, or jaw. Patients may also complain of nausea, rapid heartbeat, shortness of breath, and dizziness or lightheadedness. They may also frequently sweat. Often, heart attack patients deny that anything is seriously wrong. This is especially true when symptoms are mild or go away temporarily. If you suspect a heart attack, do not delay in calling EMS. The longer the heart goes without adequate blood flow, the more permanent damage is likely to occur. Cardiac arrest is when normal circulation of blood through the heart and the body stops due to a failure of the heart to beat effectively. Cardiac arrest is different from a heart attack, but cardiac arrest may be caused by the same reduced blood flow to the heart muscle that causes a heart attack. Although cardiac arrest is most often caused by heart disease or heart defects, it can occur any time regular heart rhythms are disturbed. Sudden cardiac arrest may occur independently from a heart attack and without warning signs. Besides a patient suddenly collapsing, there are two ways to recognize cardiac arrest. First, the patient does not respond when you speak to or touch him. He is unresponsive and not moving.
I'm an emergency responder. May I help you? Christopher, are you okay? Are you okay?
Second, the patient does not appear to have any signs of life. He is not breathing normally. Beginning CPR quickly and providing defibrillation as quickly as possible are critical to patient survival. Sudden cardiac arrest results in death if not treated immediately. Infants and children rarely suffer cardiac arrest because, with very few exceptions, they have healthy hearts. However, as a result of stopping breathing, infants and children do go on to suffer cardiac arrest if their breathing is not supported or restored. In the same way as with adults, assess whether the collapsed child is unresponsive and not breathing normally. If they are unresponsive and not breathing normally, deliver CPR. The major difference is that with infants and children, defibrillation is rarely required. Complete airway obstruction usually results when a patient chokes on food, although any object placed in the mouth could end up blocking the patient's airway. Recognizing airway obstruction is important because the patient can't breathe. Patients also tend to become embarrassed and try to leave the area. You may suspect choking if a patient grasps or clutches the neck or throat area. This is the universal distress signal for choking. By asking the patient what's wrong, you can determine if the patient can speak, is breathing, or is able to cough. A patient with complete or severe airway obstruction may become unconscious if the airway is not cleared quickly. A healthy heart will normally beat between 60 and 100 beats per minute. This heartbeat is triggered by regular, well-organized electrical impulses. Sometimes heart damage or injury to the heart muscle can cause the heart rhythm to become erratic and fast. This irregular heart rhythm does not generate a life-giving pulse, and the patient suffers a cardiac arrest. An irregular heart rhythm is potentially reversible with a defibrillator. You will use an automated external defibrillator, or AED, to deliver an electrical shock, disrupting the abnormal heart rhythms. A momentary disruption can allow the heart's normal heartbeat to return. Administering an electrical shock from an AED is called defibrillation. Prompt and early defibrillation of a patient's abnormal heart rhythm is a vital part of the chain of survival. An AED is a computerized and portable electronic machine that analyzes the cause of the cardiac arrest and, where appropriate, delivers a shock to a patient in cardiac arrest. In some cases, cardiac arrest is not treated by a shock, and the AED can reliably detect these rhythms and direct you to provide CPR until the EMS arrive. AEDs are extremely reliable, and if used inappropriately on a collapsed patient who does have a pulse, an AED will not shock. With treatable cardiac arrest, the shock delivered by the AED tries to stop the heart's abnormal activity so as to allow it to reorganize into a pulse-generating rhythm. AEDs connect to a patient via 2 chest pads, each having an adhesive gel on one side of the pad to stick to the patient's chest. When the AED is turned on, its computer analyzes the patient's need for a shock. If the AED detects a shockable heart rhythm, the AED will indicate that a shock is advised. Depending on the type of AED, you will either activate the shock by pressing a button, or the machine administers the shock automatically. You will learn how to use a specific AED model during the skills portion of this course. To treat sudden cardiac arrest, lay rescuers must be able to rapidly integrate CPR with AED use.
Christopher? Christopher!
To give the patient the best chance of survival, three actions must occur within the first
Responder.
moments of
May
a
I
cardiac
help you?
arrest.
Christopher, are you okay?
First,
Are you okay?
alert the emergency medical service, EMS. Call EMS, or if you are at work, activate your specific emergency medical response procedure. Second, use the AED on a patient as quickly as possible. The faster you defibrillate a shockable heart rhythm, the better the chances a patient has of a full recovery. Because AEDs are automatic, they're not difficult to use. Follow all manufacturer instructions. Many AEDs give verbal instructions to the user as well as visual instructions for the hearing impaired. More on this during the skills portion of the course. Third, provide CPR when prompted by the AED to do so. CPR combined with the use of an AED increases the patient's chances of survival. When you come across a possible medical emergency, what's the first thing you do? It may surprise you that the first thing you do is think about yourself. You need to protect yourself. This is for the sake of the person needing help as well as for yours. After all, if you get hurt, you can't help. Assessing a scene is the process of looking for and avoiding any dangers at the scene of a medical emergency. It's the first thing you do and the first skill you'll practice. Scene assessment takes 3 steps. 1. Stop. 2. Think. And then 3. Act. Stop and assess the scene for hazards. Ask yourself, what caused the injury? Are there any hazards? Look for potential hazards such as leaking gas, chemicals, radiation, downed electrical lines, fire, firearms, the possibility of explosion or oxygen depletion. Can you make a safe approach? Consider how to make a safe approach. Be alert for possible dangers such as oncoming traffic. Do you need to turn off the car's engine? Apply barriers as appropriate and if available. Next, think. Formulate a safe action plan. Can you remain safe while helping? Remember that your safety must be the first priority. Know your limitations. What emergency care may be needed? How can you activate local emergency medical services? Can you locate an AED? Can you have bystanders activate the emergency medical services or locate an AED?
Call for help and bring an AED. Okay. He's not breathing.
Thanks.
Think about your training and relax. Now, act. Begin providing care. To act, follow the emergency care guidelines you will learn in this course. As you help, follow the emergency first response skill sequence of priorities. But scene assessment and taking care of you never stops. Ensure your safety so you can help others in need. You've assessed the scene and determined that it is safe to assist the patient in need. Now you're ready to begin a primary assessment of the patient. Primary means first in a series or sequence. An assessment is an evaluation or an appraisal. Therefore, in terms of emergency care, a primary assessment is an emergency responder's first evaluation of an injured or ill person. Primary assessment is the first step of emergency care. Primary assessment also refers to the evaluation of a patient for any life-threatening conditions needing immediate attention. Injuries and illnesses that are life-threatening need to be treated first. By conducting a primary assessment, you will be able to answer the question, is the airway open and is the patient breathing normally? This is the AB portion of ABCAB's memory word. After you conduct a primary assessment, you proceed immediately to attend to any life-threatening conditions you discover. No matter what the patient's situation when you arrive, You begin with a primary assessment. Primary assessments all follow the cycle of care sequence that speaks directly to a pathway of priorities for emergency care. Throughout an incident, you continually monitor the patient and use the cycle of care to guide you, ready to provide assistance based on what you learn from your assessment.
Are you okay?
Let's walk through the steps of a primary assessment with an unresponsive patient. Begin by assessing the scene. Stop, think, and then act. Make sure it is safe to help the patient. Next, give the responder statement. Hello, my name is your name. I'm an emergency responder. May I help you?
Hello? My name's Nicole. I'm an emergency responder. May I help you?
This patient doesn't respond to your statement, so tap him on the collarbone to further check responsiveness. While tapping the patient, ask, "Are you okay? Are you okay?"
Are you okay?
The collarbone is sensitive, and tapping it will reveal a level of responsiveness. After delivering the responder statement, quickly check for an open airway and normal breathing. If you are unsure if the patient's airway is open or if he is breathing normally, quickly open the patient's airway using the head tilt-chin lift. To perform a head tilt-chin lift, first place your hand on his forehead. Next, place your fingertips under the point of his chin, like this. Finally, gently tilt his head back and lift his chin. Another method of opening an airway is the pistol grip lift, like this. When the patient's airway is open, check for normal breathing. To do this, look for chest movement and listen for breathing sounds. Also, with your ear next to his mouth, feel for expired air on your cheek. This check for normal breathing must be accomplished quickly. If the patient is not breathing normally, he needs CPR immediately. Avoid long delays. If the patient is not responsive or breathing normally,
And bring an AED.
ask a bystander to call EMS and secure an AED if possible. If you are alone, use your mobile phone to call EMS. If you do not have a mobile phone, leave the patient to call EMS if no other option exists. This is the call-first approach to emergency care. You call first to activate emergency medical services, then you provide assistance. When an adult patient stops breathing normally and his heart is beating erratically or not at all, you can substitute manual chest compressions for the heart's normal pumping action to circulate blood through the body. The blood you push through the patient's body will carry some oxygen to important organs. Your willingness to respond may increase the patient's chance for survival until emergency medical service personnel arrive. CPR is a two-step process. Step 1, chest compressions, followed by Step 2, rescue breathing. In this skill, you'll learn how to perform chest compressions. If you are unable or feel uncomfortable giving a patient the rescue breaths, relax. Give the patient immediate and continuous chest compressions. Chest compressions alone are very beneficial to an unresponsive patient who is not breathing normally. Your efforts will still help circulate blood that contains oxygen. Begin as usual by assessing the scene for safety. Next, check the patient for responsiveness by giving the responder statement.
Hello? My name is Penny. I'm an emergency responder. May I help you?
If no response to your statement,
okay?
then tap the patient
Are
on
you
the
okay?
collarbone and ask, "Are you okay? Are you okay?" After delivering the responder statement, quickly check for an open airway and normal breathing. Here's an important note about normal breathing. In the first few minutes after cardiac arrest, the patient may be barely breathing or taking infrequent, noisy gasps. This is often termed agonal breathing, and these gasps must not be confused with normal breathing. Many patients in cardiac arrest make these gasping sounds. If the patient is not responsive or breathing normally, ask a bystander to call EMS and secure an AED if possible. If you are alone, use your mobile phone to call EMS. If you do not have a mobile phone, leave the patient to call EMS if no other option exists. This is the call-first approach to emergency care. You call first to activate emergency medical services, then you provide assistance.
1, 2, 3, 4, 5, 6, 7.
Now, position the patient on his back if not already in this position. If necessary, expose the patient's chest. Find the compression site by putting the heel of one hand in the chest center. On some individuals, this position is between the nipples. Place your other hand on top of the hand already on the chest and interlock your fingers. Use the palm of your hand on the compression site. Keep your fingers off the patient's chest. Next, position yourself so that your shoulders are directly over your hands and your arms are straight. Lock your elbows, like this. Now deliver the chest compressions, keeping the force of the compressions straight down and avoid pushing on the rib cage or the lower tip of the breastbone. Allow your body weight to deliver the compressions. To provide effective chest compressions, you should push hard and push fast, depressing the breastbone approximately 1/3 the depth of the patient's chest, at least 5 centimeters or 2 inches. After each chest compression, release, allowing the chest to return to its normal position. Repeat at a pace of 1, 2, 3, 4, and so on, for 30 chest compressions. Perform the compressions as fluidly as possible. Your rate should be at least 100 compressions per minute. The rate is a lot faster than most people think. Push hard and push fast. With your instructor, you will practice chest compressions using an adult CPR mannequin. Do not perform chest compressions on someone who does not need CPR. As you've learned, chest compressions alone are very beneficial to a patient who is unresponsive and not breathing normally. However, if you are also willing to provide rescue breaths to a patient in need, you may further increase the patient's chance for survival until emergency medical service personnel arrive. After completing this skill, you should trust your training and provide an unresponsive patient who is not breathing normally with complete CPR, chest compressions, and rescue breathing. As always, begin by assessing the scene and give your responder statement.
Hello, my name is Juanita. I'm an emergency responder. May I help you?
Next, tap the patient on his collarbone and
okay?
ask,
Are you okay?
after you deliver your responder statement, quickly open the patient's airway and check for normal breathing. If the patient is not responsive or breathing normally, ask a bystander to call EMS and secure an AED if possible. If you are alone, use your mobile phone to call EMS. If you do not have a mobile phone, leave the patient to call EMS if no other option exists. This is the call-first approach to emergency care. You call first to activate emergency medical services, then you provide assistance. As in the previous skill, find the compression site by putting the heel of one hand in the chest center. On some individuals, this position is between the nipples. Place your other hand on top of the hand already on the chest and interlock your fingers, like this. Now, position yourself so that your shoulders are directly over your hands and your arms are straight. Lock your elbows. Now deliver the chest compressions. Keep the force of the compressions straight down and avoid pushing on the rib cage or the lower tip of the breastbone. Allow your body weight to deliver the compressions. To provide effective chest compressions, you should push hard and push fast, depressing the breastbone approximately 1/3 the depth of the patient's chest, at least 5 centimeters, 2 inches. After each chest compression, release, allowing the chest to return to its normal position. Repeat at a pace of 1, 2, 3, 4, and so on for 30 chest compressions. Perform the compressions as fluidly as possible. Your rate should be at least 100 compressions per minute. The rate is a lot faster than most people think. Push hard and push fast. After delivering 30 chest compressions, quickly position a ventilation barrier on the patient and open the patient's airway. To open a patient's airway, you will use the head tilt chin lift. First, place your hand on the patient's forehead. Next, apply firm backward pressure with the palm of your hand, tilting the head back, like this. Place the fingers of your other hand under the bony part of one side of the lower jaw near the chin. Avoid pushing directly under the chin. Lift the jaw upward to bring the chin forward. This immediately opens the airway. Now, with the patient's head tilted back and the ventilation barrier in place, begin your rescue breaths by pinching his nose closed. Give 2 rescue breaths with each lasting about 1 second. Provide the patient with just enough air to make the patient's chest rise. Look for this rise in the patient's chest. If you can't make the patient's chest rise with the first breath, repeat the head tilt chin lift to reopen the airway before attempting another breath. Improper position of the head tilt chin lift is the most common cause for not being able to inflate a patient's lungs. Do not try more than 2 rescue breaths to make the chest rise. Minimize delay between chest compressions. After 2 breaths, whether they make the chest rise or not, begin chest compressions again. After delivering 2 rescue breaths, immediately begin another cycle of 30 chest compressions. Continue alternating 30 chest compressions with 2 breaths until emergency medical service personnel arrive. You can defibrillate with an automated external defibrillator. The patient becomes responsive and begins to breathe normally. Another emergency responder arrives and takes over your CPR efforts. Or lastly, you are too exhausted to continue. If more than 1 emergency responder is present, consider alternating care. To avoid fatigue, each provider can deliver CPR for 2 minutes and then switch. While switching providers, minimize chest compression interruptions. With your instructor, you will practice complete adult CPR, chest compressions, combined with rescue breaths, using an adult CPR mannequin. Do not perform chest compressions on someone who does not need CPR. When an adult patient is unresponsive and not breathing normally, you now know how to provide him with complete CPR, chest compressions combined with rescue breaths. That's a great start, but you may be able to help further by using an AED. As you've learned, an AED is a sophisticated, battery-powered, microprocessor-based device that incorporates a heart rhythm analysis and shock advisory system.
Shock delivered.
AEDs can automatically and reliably deliver a shock to a patient who is not breathing normally and whose heart has an abnormal rhythm. The electrical shock from an AED can momentarily disrupt the abnormal heart rhythm and allows the heart's normal heartbeat to return. Once a normal heartbeat returns, blood can again flow to the brain and body organs. Administering an electrical shock from an AED is called a defibrillation. Prompt defibrillation of a patient's abnormal heart rhythm is a vital part of the chain of survival. The following overview provides you with a generic and universal procedure used by most AEDs. AEDs manufactured by different companies operate differently. Your instructor will guide you on the specifics of the AED used in your course. When confronted with an unfamiliar AED model, refer to the manufacturer guidelines and instructions prior to needing the AED during an actual medical emergency. Even if you find yourself having to use an unfamiliar AED model, don't worry. Most are intuitive and very easy to use. AEDs are simple to operate because they have voice and visual prompts to assist you with setup and treatment of the patient in need.
Place 1 pad on bare upper chest.
As always, begin by assessing the scene and give your responder statement.
Hello? My name's Nicole. I'm an emergency
Next,
responder.
tap
May I
the
help
patient
you?
on his collarbone and ask, "Are you okay? Are you okay?" After you deliver your responder statement, quickly open the patient's airway and check for normal breathing. If the patient is not responsive or breathing normally, you or a bystander should first call EMS. Next, if a bystander can go get an AED, direct them to do so while you begin CPR. Once the person arrives with the AED, have them set it up and place the chest pads on the patient while you continue CPR. This minimizes interruptions to chest compressions. If you are alone and know where to find an AED close by, leave the patient to quickly secure the AED. Once an AED is secured, position the AED close to the patient's ear on the same side as you, the rescuer. Turn the AED power on and follow the device prompts exactly. Bare the patient's chest. If the patient is wet, consider quickly drying the chest prior to pad placement. Further, it is not uncommon for a razor to be included with an AED. If available, use it quickly to shave excess body hair where the pads will be placed. Remove defibrillator pads from packaging and peel away any protective plastic backing from the adhesive pads. As directed by the manufacturer, place defibrillator pads on the patient's bare chest, adhesive side down. Note the placement illustrations on pad packaging or pads themselves. Typically, one pad goes here, on the upper right side of the chest, below the collarbone and next to the breastbone. A second pad typically goes here, on the lower left side of the chest, to the left and below the nipple line. Plug in the AED pads if needed or prompted. Almost immediately, the AED will begin to analyze the patient's heart rhythm, although some AEDs require you to push an Analyze button. Clear rescuers and bystanders from the patient, making sure no one is touching the patient. Also, make sure no equipment is touching the patient. Say, "I'm clear, you are clear, everyone is clear." If the AED advises that a shock is needed, the responder should follow the prompts to provide one shock, followed by CPR. If the AED does not advise a shock, immediately resume CPR.
Don't touch patient. Analyzing.
The AED will again analyze the patient's heart rhythm.
Don't touch patient.
If normal breathing is still absent, the AED may prompt you to deliver another shock.
Start CPR.
Most AEDs will wait 2 minutes before analyzing and shocking the patient again. During that time, continue CPR. As prompted, continue to give single shocks combined with CPR until the patient resumes breathing, until relieved by EMS personnel, or until you are physically unable to continue. Now let's look at the minor differences between adult and child CPR and AED use. We'll also highlight some of the important similarities. First, it helps to define that a child is an individual between the ages of 1 and 12 years. Regarding this definition, when in doubt about a patient, whether they are a child or an adult, treat the patient as an adult. Primary similarity with adult CPR is that with children the ratio of chest compressions to rescue breaths is still 30:2, and the rate of compressions is at least 100 per minute. Deliver the chest compressions as fluidly as possible. Remember, you should always push hard and push fast. Further, after each chest compression, release the pressure without taking your hands off the child's chest, allowing the chest to return to its normal position. After delivering 2 rescue breaths, immediately begin another cycle of 30 chest compressions. Minimize delays in providing chest compressions. One treatment different between adults and children is when to call EMS. If bystanders are present when you first find an unresponsive child that is not breathing normally, send them to call EMS and retrieve an AED while you provide CPR. If you are alone and no bystanders are present, you will need to follow the resuscitation guidelines for your region. Your instructor will guide you. The American Heart Association guidelines specify for you to deliver 5 sets of 30 chest compressions and 2 rescue breaths before calling EMS or retrieving an AED. The European Resuscitation Council guidelines specify for you to deliver 5 initial rescue breaths followed by 1 minute of CPR before calling EMS or retrieving an AED. The Australian and New Zealand Resuscitation Council guidelines do not specify care first over call first when a child needs CPR. Nevertheless, in this region, provide 1 to 2 minutes of CPR before calling EMS or retrieving an AED. Another difference from adult emergency care is the emphasis on providing children with rescue breaths, along with chest compressions. Often a child's heart stops because of breathing difficulty, or they cannot breathe at all. To deliver rescue breaths to a child, open the child's airway and pinch the nose closed as with adults. However, for very small children, you may be able to cover their mouth and nose with yours to provide rescue breaths. Unlike adults, with small children, you may use one hand to deliver chest compressions. If you can't push the breastbone down approximately 1/3 the depth of the child's chest, or at least 5 centimeters or 2 inches, use 2 hands like adult CPR. Once an AED is available, use it to further assist the child. As with adults, turn the AED on and follow the visual or verbal prompts. If the AED has child-specific defibrillator pads, remove them from the packaging and peel away any protective plastic backing from the adhesive pads. If the AED has a child-specific setting, use it. If child pads are not available, or the AED does not have a child key or switch, use the adult pads or adult settings. When using adult pads on a child, ensure the pads do not touch each other on the child's chest. As directed by the manufacturer, place defibrillator pads on the child's bare chest, adhesive side down. Note the placement illustrations on pad packaging or pads. For best shock results, some manufacturers illustrate placement of child-specific pads different than adults. They illustrate one pad to be placed on the middle of the child's back between the shoulder blades and the other pad in the middle of the chest.
Look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly by.
Now, use the AED as you would with an adult.
Shock delivered. Press the
Follow the AED's verbal and/or visual prompts. If prompted, give shocks combined with CPR until the child resumes breathing or until relieved by EMS personnel. Now, let's look at the minor differences between adult, child, and infant CPR. We'll also highlight some of the more important similarities. First, it helps to define that an infant is a baby who is younger than 1 year. The primary similarity with adult and child CPR is that with infants, the ratio of chest compressions to rescue breaths is still 30-2, and the rate of compression is at least 100 per minute. Deliver the chest compressions as fluidly as possible. After delivering 2 rescue breaths, immediately begin another cycle of 30 chest compressions. Minimize delays in providing chest compressions. One treatment difference between adults and infants is when to call EMS. If bystanders are present when you first find an unresponsive infant that is not breathing normally, send them to call EMS while you provide CPR. If you are alone and no bystanders are present, you need to follow the resuscitation guidelines for your region. Your instructor will guide you. The American Heart Association guidelines specify for you to deliver 5 sets of 30 chest compressions and 2 rescue breaths before calling EMS or retrieving an AED. The European Resuscitation Council guidelines specify for you to deliver 5 initial rescue breaths, followed by 1 minute of 30 chest compressions and 2 rescue breaths before calling EMS or retrieving an AED. The Australian and New Zealand Resuscitation Council guidelines do not specify care first over call first when a child needs CPR. Nevertheless, in this region, provide 1 to 2 minutes of CPR before calling EMS or retrieving an AED. Unlike adults and children, you perform chest compressions with 2 fingers, pushing straight down on the infant's breastbone just below the nipple line. To provide effective chest compressions, you should push hard and push fast, depressing the breastbone 1/3 the depth of the infant's chest, or approximately 4 centimeters or 1.5 inches. With infants, it's better to push too hard than not hard enough. After each chest compression release, allow the chest to return to its normal position. Repeat at a pace of 1, 2, 3, 4, and so on for 30 compressions. Another difference from adult emergency care is the emphasis on providing infants with rescue breaths, along with chest compressions. Often an infant's heart stops because of breathing difficulty or they cannot breathe at all. To deliver rescue breaths to an infant, first open the infant's airway and take a breath yourself. Next, cover the infant's mouth and nose with your mouth. If your mouth is too small, simply put your mouth over the infant's nose and hold his mouth closed to prevent escaping air. Now give the infant 2 rescue breaths. With infants, rescue breaths are more like puffs of air. Each breath should last about 1 second. During this skill, you'll learn how to assist a conscious and unconscious choking adult and child with a partial or complete, also known as a severe airway obstruction. The steps for assisting a conscious choking adult or child are the same. However, the steps for assisting a child who becomes unconscious while choking are different from the steps for assisting an adult who becomes unconscious while choking. Those similarities and differences will be shown. Let's begin with a conscious choking adult or child. First, begin by asking the responsive adult or child, "Are you choking?" If the patient is coughing, wheezing, or can speak, partial airway obstruction, observe until the patient expels the obstruction. Reassure and encourage the patient to keep coughing to expel the foreign material. Call EMS if breathing becomes worse. If the patient cannot cough, wheeze, or speak, give the responder statement. "Hello, my name is," your name. "I'm an emergency responder. May I help you?" When permission is granted, a head nod is sufficient. Alert EMS and proceed with attempts to dislodge the object using either abdominal thrusts or chest thrusts. To begin abdominal thrusts, stand behind the child or adult and place your arms around their waist. You may need to kneel with a small child. Next, locate the patient's navel, the belly button. From that point, the thrust site is 2 finger widths above it. After locating this position, make a fist and place the thumb side on the thrust site. Now place your other hand over the outside of the fist. Bend your arms and elbows outward to avoid squeezing the rib cage and perform quick inward and upward thrusts. You continue these thrusts until the obstruction is cleared or the patient becomes unconscious. Once the obstruction is cleared, encourage the adult or child to breathe. Monitor the patient carefully and either call EMS or transport the patient to the hospital. Consider administering chest thrusts if abdominal thrusts are not effective. Regardless, begin with chest thrusts on patients who are pregnant or markedly obese. Use chest thrusts even with obese children. To initiate chest thrusts, stand behind the adult or child and place your arms around their body under the armpits. You may need to kneel with a small child. Next, follow the lowest rib upward until you reach the point where the ribs meet in the center. Feel the notch of the lower half of the breastbone and place your middle and index finger on the notch. This is the same compression point on the breastbone as for CPR. Once at that position, make a fist and place the thumb side on the thrust site above your fingers on the notch. Place the other hand over the outside of the fist. Perform quick inward thrusts until the object is expelled or the patient becomes unconscious. As with abdominal thrusts, avoid putting pressure on the rib cage. You can continue these thrusts until the obstruction is cleared or the patient becomes unconscious. Once the obstruction is cleared, encourage the adult or child to breathe. Monitor the patient carefully and either call EMS or transport the patient to the hospital. If a responsive choking adult becomes unconscious while you are trying to help, carefully help the unconscious adult to the ground. Next, activate EMS if not already called. If you're alone, use your mobile phone to call EMS. If you do not have a mobile phone, leave the patient to call EMS if no other option exists. Once EMS is alerted, begin CPR as per Skill 4, Adult CPR, chest compressions combined with rescue breaths. Following each set of chest compressions, quickly look in the adult's mouth and attempt to remove any visible obstruction. If an object is seen, you should remove the object with your finger. If no object is seen or the object has been removed, proceed with 2 rescue breaths. Continue CPR until obstruction is relieved or EMS arrives. If a responsive choking child becomes unconscious while you are trying to help, carefully help the unconscious child to the ground. Yell out for help and assistance. If no one comes to your assistance, begin CPR as per Skill 6, Child CPR and AED use. Following each set of chest compressions, quickly look in the child's mouth and attempt to remove any visible obstruction. If an object is seen, you should remove the object with your finger. If no object is seen or the object has been removed, proceed with 2 rescue breaths. Continue CPR. 30 chest compressions, followed by 2 rescue breaths. After 5 sets of CPR, call EMS and get an AED if close by. Continue CPR until obstruction is relieved or EMS arrives. During this skill, you'll learn how to assist a conscious and unconscious choking infant with a partial or complete, also known as a severe, airway obstruction. Let's begin with a conscious choking infant. If a parent or guardian is present, give the responder statement and ask if you may assist the infant. If available, send someone to alert EMS. If alone, continue assisting the infant. If the infant is coughing, wheezing, or crying, partial airway obstruction, observe until the object is expelled by the infant's own efforts. Encourage the infant to keep coughing to expel the foreign material. However, if the infant is obviously choking but cannot cough, wheeze, or cry, immediately look in the infant's mouth and carefully remove any visible objects. Should no visible objects be seen in the infant's mouth, use back blows to help the infant expel the object. First, position the infant face down on your forearm and support the infant's head and neck with your hand, like this. With the infant's head slightly lower than the body, deliver up to 5 distinct and separate back blows between the shoulder blades with the heel of your hand, like this. The aim is to relieve the obstruction with each blow rather than to deliver all 5 back blows. If the object is not dislodged after 5 back blows, support the infant's head and turn the infant over. Keep the infant's spine straight while turning him over. Look in the infant's mouth and carefully remove any visible objects. Consider administering chest thrusts if back blows are not effective. To perform chest thrusts on an infant, place him on his back. You may rest the infant on your arm or thigh by positioning his head lower than the body. Next, locate the chest compression site. This is the same compression site as infant CPR. Provide up to 5 distinct chest thrusts. The aim is to relieve the obstruction with each compression rather than to deliver all 5 chest thrusts. After the chest thrusts, or if the infant begins to cry, look in the infant's mouth and carefully remove any visible objects. If the object is not dislodged, repeat back blows and chest thrusts. Continue until the object is dislodged and the infant begins to breathe, cry, or cough, or the infant becomes unconscious. If a responsive, choking infant becomes unconscious while you're trying to help, place the infant on a flat, firm surface. A table or crib will work. Your forearm can also be used to support the infant. Next, yell out for help and assistance and begin CPR as per Skill 7, Infant CPR. Following each set of chest compressions, quickly look in the child's mouth and attempt to remove any visible obstruction. If an object is seen, you should carefully remove the object. If no object is seen or the object has been removed, proceed with 2 rescue breaths. Continue CPR. 30 chest compressions, followed by 2 rescue breaths. After 5 sets of CPR, call EMS. Continue CPR until obstruction is relieved or EMS arrives. As an emergency responder, you play a crucial role in a medical emergency. Your skills make you the critical first link in the chain of survival that summons emergency medical aid, uses the cycle of care to increase the chances of survival or revival. Few emergency responders ever need their skills, but if you ever do, you'll be ready to reach out and help. Emergency First Response, creating confidence to care.